data breaches. My name is Brian Bilodeau, and I'm the president of 1440 Security. The title of this webinar is How to Prevent Data Breaches. You might say you can't, and from a planning standpoint, you have to assume that you won't be able to be breach-free forever. However, every organization that has confidential data in their possession has to do at least two things. First, you have to do your best to prevent breaches. And secondly, if and when there is a breach, you have to be in a position to catch it as early as possible to minimize the impact. In the next 20 minutes or so, you'll hear key indicators in the healthcare market that highlight the major risk healthcare is facing, 6 practical steps to mitigate security risk, and then some real numbers that can help you quantify risk and the return on investment for security initiatives. I want you to be aware that this session is being recorded and will be available on our website along with a copy of this presentation later this week. Any company or industry that deals with personal or private information that can be used for profit, either by replicating credit or banking information or for identity theft, is a target. Healthcare is a particularly good target because the data in your care contains names, birth dates, policy numbers, and information which enable the possessor a number of things, including buying medical equipment or drugs that can be resold, filing fraudulent insurance claims, exploiting credit card data, typically we think for breaches, and then committing identity theft. This makes healthcare records far more valuable than the data from other sources. In this graph, it shows that if you look at the bottom, public records are worth about $86 per record, and they're the lowest on the totem pole in terms of value, but they still have value. Now, healthcare records are almost 5 times more valuable than that at $402 per record. This is from a Ponemon study from 2016 on the cost of records per industry. Now, health records are 2 times more valuable than those stolen from retail chains, like the most recent breaches we heard about from Sonic and Pizza Hut and Whole Foods. And they're 52% higher than the financial data like that, which was stolen from Equifax. This is why healthcare has to be on high alert. There's a bullseye on healthcare. In fact, there were 450 breach incidents in healthcare in 2016, which is more than 1 per day, that affected more than 27 million patient records. Interestingly enough, insiders caused 43% of those data breaches, and not all of those were malicious in intent. About 61% of those were from accident or error, and then another 49% from wrongdoing. Hacking and ransomware was responsible for close to 27% of the breaches, and the overwhelming majority of those were from healthcare providers instead of third parties. Perhaps the most startling is that it took the average breach victim 233 days to figure out that they had been compromised, with the slowest to catch on being a mind-boggling 607 days. Now that's roughly 8 months on average and 20 months at the edge to discover a breach, which is more than enough time for a threat actor to find and steal all the data they want. And this costs healthcare companies big time. In a recent study published by Ponemon Institute, the average cost of a data breach in the US over the past 4 years is $6.7 million and rising. In 2017, the average cost of a breach was well above $7 million. Many of you on the call are directly responsible for preventing this from happening at your company, or you're part of the team that is, so no pressure, but we're going to share some things with you that we hope will be helpful going forward. Here are some examples of breaches that are making up the 2017 number. An attacker, apparently intent on extortion, hit Oral Facial Surgery Center in Lafayette, Arkansas, with ransomware that encrypted X-ray images, files, and documents of more than 127,000 patients. The center is now offering 3 years of free credit monitoring and warning their patients to be on the lookout for phishing attacks. That is not a message that instills confidence in their patients. In a In another case, hijackers took 26,000 Mongo database servers and encrypted those, and then asked for an estimated $7 million to restore the data. MacKeeper and Emory Brain Center were two healthcare companies that made up the majority of these breach numbers. And in one case, there were 45,000 databases that were destroyed that contained 3 years of data that was being used for leukemia patients to improve their treatments. The outcome of these is not really being shared by the company, but we suspect that the ransom was paid. At Bupa Global Health, an insider copied and stole private patient records from 108,000 global health insurance policies. The employee was fired, but Bupa is undergoing extensive investigation, including government and health regulators. Now, I'm sure that's much more painful and extensive than if they had done this beforehand and improved their policies before a breach occurred. We have to slow the attack on healthcare and make it much harder. Over the next 4 slides, we're going to give you several steps that you can take to protect your network and the patient data that's in your care. Hopefully, you'll hear some new ideas or be reminded of actions that you are already aware of that you can take, and then move them to the top of your priority list. I'm not going to cover each item in the list, but we'll highlight the key points. And this presentation, as I said earlier, will be available on the web at our website after this webinar, so you can download it and review it. Now, the actions on this slide that I'm going to point out are ones that take either no cost or very little cost. The 2 specific ones I want to cover are the use of multi-factor authentication and then restricting data access. Neither one of these are going to make you very popular with your staff, but both can significantly reduce your risk. So for multi-factor authentication, use at least 2-factor authentication. And you can find minimally intrusive way to implement this, like turning on firewall options that support it, or a lot of applications today support multi-factor authentication. And then you can use something like Google Authenticator on a mobile phone that can provide that second piece. That's relatively, there's no cost associated with it, and it's pretty straightforward to use. The second that I want to point out is to be as restrictive and as tight as possible as you can be with access to applications and data. Now, you don't want to restrict business. You don't want to keep business from happening, but only allowing those that need access to data to be given access, you can significantly lower the risk of insider issues that are either accidental or malicious. Now, remember, 61% of the ones we showed earlier were even by accident, so it doesn't always cause something malicious in order to have a breach occur. Also, don't overlook the easy stuff. There's a couple I want to point out here. Now, passwords is the first one. Make passwords or require passwords that are hard to steal. Not a very sexy topic, but it's a key element to any security posture. If a threat actor can't get the credentials to access the data, it makes data exfiltration a lot harder. So here's a few tips. Use long passphrases, which are several unrelated words that are tied together, made up of at least 20 characters. And I'll give you an example here. And it's proven that these are actually harder to crack than complicated passwords. And it makes it easier to remember. Use a password vault, something like LastPass or Dashlane. That keeps it easy to remember and easily accessible. Another tip would be to have people lie on security questions. Somebody pointed that out to me earlier. It didn't really occur to me to do that, but there's no reason to tell the truth in this case. But you just got to make sure you can remember what you answered on the security questions. Why would you give a threat actor the ability to use Facebook to figure out what your password is? Now, I didn't highlight this one, but given the recent events at Heathrow, disable USB ports. That's a great way to keep data in your environment rather than allowing it out on USB drives. The third one on the slide, second one on the slide I want to point out is to isolate legacy systems. Legacy systems have a tendency to be less secure and present a weak spot on the network. Either they fail to encrypt passwords, don't enforce password standards, or they've got multiple entry points that really expand the attack surface. If you separate these applications from the rest of your environment and from the data or patient data, wherever is possible, then you limit your exposure and you make it harder for attackers to get in. Now, here are a few actions that have some high value with limited cost that you can take. The first one I want to point out here is to encrypt electronic healthcare records and private data wherever you can. Use full disk encryption, either hardware-based for new systems, which is becoming more prevalent and cheaper to use without impacting productivity, or use software-based encryption and use secure file transfer technology to encrypt data in transit as part of a multi-layer security strategy, so that if or when a threat actor gets into your environment, they can't get to the data, or it makes it really hard for them to get it. The other one highlighted here is potentially the most effective action you can take, which is to train and test your organization to be resilient against phishing attacks. Recent studies show that approximately 90% of breaches start with phishing. One popular phishing company has statistics from their client base that show 31% of employees in healthcare organizations click on phishing emails that could have been that kind of activity that would have compromised them. Now, I was listening to an interview last week with Robert Herjavec, and at one point in the presentation, he's discussing a conversation he had with a friend of his who runs a government agency in the U.S. That was established to protect the infrastructure, United States infrastructure, from cyber attack. And they said that they actually spend 95% of their time helping hospitals fight malware, and phishing is the prevalent way that malware gets into an organization. Finally, on this slide here, I want to talk about the kind of things that are a little bit harder to get to. So get help on the things that are harder or more time-consuming, or that are tough to find, or to retain staff to find the necessary skills. An annual penetration test is a must. No matter how tight your security posture is, you should put your defenses to the test. If they get through, then you know where you're exposed and can close the gap. And some compliance standards require that you get it at least twice a year. And then make sure you retest overall after all major network outages. Secondly, find the right security partner to help your organization, especially if a SIM is part of your technology stack. Think of them as an extension of your team, not to outsource all activity, but how to divide up the effort to leverage the best of both teams. Make them do the heavy lifting so you can focus on the high value events or the rest of the projects that I'm sure are already on your plate. Now, I want to talk for a few minutes on numbers. So how much money can actually be saved by putting some of these things in place? Well, first of all, let's be clear that threat actors are very busy. In fact, you don't even have to be a hacker anymore. You can purchase tools and services to compromise a network and steal data. There were 253 breaches in 2015 and 450 in 2016, with a healthy dose so far this year. So this isn't going away anytime soon. Now, let's look at some numbers that can help with investment or ROI and risk mitigation conversations. Now, at least 72% of healthcare organizations spend less than 6% of their budget on security. CIO magazine says that typically spending ranges from 11% for large enterprises to 15% for smaller enterprises. Gartner, on the other hand, advises that spending on security should be somewhere between 4% and 7% of an IT budget. Lower in the range if the position is mature, and higher if you're still pitching up. Of course, you shouldn't spend $10 million to mitigate $1 million in risk, but let's be clear, it's really easy to underestimate the cost. Earlier in the presentation, we cited Pondman research quantifying the average cost of a breach in 2017 so far is $7.3 million per incident. Now, these are some factors to be aware of as far as spending is concerned. And now I want to show you a couple of things that can help either increase that number or decrease it and the financial impact. So here's some interesting ones. Some factors that decrease the cost of a breach. Organizations that have a designated incident response team and a process for handling incidents reduce the impact, the financial impact of a breach by 13.5%. Using the average cost of a breach so far in 2017 at $7.3 million, that's close to $1 million of an impact that you can reduce the cost of any breach. Organizations that provide security training and testing and test their employees using phishing techniques specifically reduce the impact of a breach by 12.5%, or another $918,000. A third one that I want to point out, because we talked about earlier as well, it's a great thing that you can do, is to put encryption technology in place. And organizations that put encryption technology in place reduce the impact of a breach by a little over 11%, or $833,000 per incident. If you add something to that, like security analytics, you can bring it down another 5%, almost another $400,000. And in total, organizations that put these four things in place can take a 50% reduction in the impact of a breach, or $3.1 million. All right. There are some things, of course, that you can do that have a negative impact. And so here are some things that would increase the cost of a breach that you don't want to take your eye off of. So organizations that fail to maintain existing compliance requirements and take their eye off that ball can lose up to $470,000, or 6.4% increase in the cost of a breach. The extensive use of mobile platforms increases the impact of a breach by 8%, or a little over $500,000. So if you take your eye off these two things, the cost of a breach can go up almost $1 million. So that's very very expensive. So there's some numbers that I hope will give you some ammunition kind of to look at. Well, what are the projects that we should invest in that will help reduce our exposure on the security side? Okay, we covered a number of practical actions that you can take in any organization to strengthen your security posture. I trust you were able to identify at least one that you're not doing today, or not doing as well as you would like, that you can take some action on this week. Now, we'll take a few minutes here to take some questions from the audience. So if you've got a question, please type it in the chat window and we'll do our best to answer them. All right, let's see. It looks like we've got a couple of questions here. All right, the first one is, what are the top 2 actions a healthcare provider should take to make the biggest dent in reducing risk? Well, thank you for the question. That's a great question, because there's so many things that can be done depending upon how strong your security posture is today. The top 2 actions we recommend are restricting access and training and testing organizations in phishing. So if you restrict access on critical applications on a need-to-know basis and implement multi-factor authentication, that can really reduce your impact of a breach. Prioritize the applications based on your annual risk assessment, or the sensitivity and the criticality of the data of those apps. Now, given that 90% of breaches start with email, the second action we recommend is to train and test your organization on phishing. And I would do it on a regular basis, either monthly or quarterly. Have it tailored for different types of roles in the company based on the department, and then do it on an unannounced basis. You want to start with a baseline, and then do some training and education, and then have some unannounced phishing attempts during the year and see who's participating in that and who's learning, and then provide some additional opportunities for education. There's a third one that's closely related because it's intended to eliminate or reduce the threat of ransomware and malware, and that's to put a strong endpoint protection system in place. And there's several good ones out on the market. So thank you for that question. Do we have other questions from the group today? All right, we have another question. Thank you. If a breach is inevitable, why do anything beyond the minimum? Well, I suppose it's evident that there's some companies out there that are doing just that, the minimum, even if they're getting that far. So you're not alone in this train of thought. The budgets of healthcare companies show that this approach, while it's not explicitly stated, kind of can be the byproduct of a lack of investment. The reasons to take some action other than just the minimum is really all about risk mitigation. There are specific breach disclosure timelines that an organization has based on how many records were compromised. And it's proven that an organization that has reduced its attack surface and defined an incident response process and put a designated owner over that process, that they significantly reduce their exposure and the amount of records that are compromised. So this brings down potential fines, can potentially eliminate the need for disclosure at all, certainly reduce the breadth of the audience that could participate in a class action lawsuit. So there's a number of things that you want to be able to avoid, and so it's really all about risk mitigation. And I'm sure today, if you had a conversation with the folks over at Equifax, they would tell you that they would have done a better job at following through with patching systems, which is really low-hanging fruit. So you definitely want to take some actions to mitigate risk. Thank you for that question. Are there other questions from the group? Okay, if not, well, thank you for that. There's a couple of things I want to cover right here at the end. So thank you for your questions and the participation today. I hope in this brief presentation it gave you a few ideas and sparked some thoughts on inexpensive steps that you can take to tighten your security posture. Just a quick note on 1440 Security and who we are. We are a security service provider based in Dallas and have been in business since 2000, helping organizations with compliance and security needs. Here are a few of the services with regards to threat detection and compliance that we deliver out of our 24/7 SOC in Dallas. And we're inviting attendees of the webinar to take advantage specifically of our phishing service offering, which is powered by KnowBe4, Gartner leading phishing solution. So any participant that orders our phishing services by the end of this year will get a 50% discount on the program, which includes, I think I mentioned, a baseline phishing effort followed by an enterprise-wide training and education session, and then 3 or quarterly unannounced phishing tests throughout the year with additional training for the winners, as I call them. You can contact us off our website at 1440security.com. I've listed my email address and phone number here, and then please take a moment to follow us on Twitter or LinkedIn. Now, this presentation, the recommendations, the numbers that I provided, and this contact information will be in the presentation that we'll make available on our website later this week once this closes. Thank you very much for your participation. You have a great day.